Hello, good evening all. I'm Dr. Regina. It's been almost 8 years in this field of prometric examinations. Okay, so here I'm going to discuss few things or an overview regarding this GCC or Gulf countries examinations. Okay, and here we are discussing about prometric exam. What are the different types of prometric exams? Then exam format. Then eligibility criteria. How can we get into that exam? When we can reach standard? The eligibility criteria, syllabus overview, exam result, and what are the exam like exam centers, exam dates. Then after that, other procedures like data flow, credentials, and how can we apply and all. Okay, so we'll provide an overview regarding all the points regarding this GCC exam, Gulf countries examinations. Okay, so here first, the types of examinations. Okay, different types of examinations are there for different countries, known as, different names are for each countries. Okay, remember one thing, Europe, when we compare to European examinations, it is very easy to clear our exam, this GCC examinations or prometric exams. Okay, because in European countries, for attend to that kind of examinations, different steps are there with the like complicated procedures included. Okay, but for this Gulf countries examinations, only two types, two appears or like the approaches are there. First one is that we have to attend the MCQ type of examinations by computer-based examinations, and we'll discuss in detail later. Okay, and then directly into the registrations, license procedures, and all. Okay, that is enough. So it is very easy to clear and easy to appear for this Gulf countries examinations. So that is why we are preferring more into this kind of examinations. And we can easily get into that countries, and we can easily find out the job chances and all. Okay, so that is why we are focusing on Gulf countries examinations or prometric examinations. So listen, what are the different types of examinations? Remember, for the countries are exposing countries are UAE, Bahrain, Oman, Qatar, Saudi, and all these countries are the okay. They are accepting licensing examination from Indian dentist. Okay, and for this UAE, different countries, different exams are there. Okay, remember for UAE, HAD is there. HAD previously HAD, and nowadays it is known as DOH. Both are same. Okay. Previously that the name is HAD, and now it is converted into the name DOH. Okay, so for both, that is for DOH is for Abu Dhabi. From UAE for Abu Dhabi, the examination is known as HAD or DOH. Okay, then other areas of the UAE like Dubai will the examination name is DHA for Dubai, and MO is for other areas like Sharjah, Ajman, etc. Okay, so remember Abu Dhabi HAD or DOH, and for Dubai that is DHA, and MOH that is for Sharjah and Ajman type of other emirates of the UAE. Okay, and like that for Qatar the examination is known as QCHP or Qatar Prometric Examinations. Okay, like that for Oman that is known as OMSB, and that is Oman State Medical Board Examinations, and OMSB is recently converted into Pearson VUE. Okay, so that is conducted by a team Pearson VUE. That is why the name that is nowadays known as Oman Pearson VUE Examinations. Okay, and like that for Saudi SDLE examinations are there, and for Bahrain that examination name is known as NHRA. Okay, so no need to consider the Bahrain now, because Bahrain they stopped the like as a part of localization. They stopped the licensing examinations for Indians or for other countries since July 2021. So no need to consider that. Okay, no need, if you are a general dentist, then no need to consider Bahrain. Bahrain not at all a choice. Okay, because they are not conducting licensing examination nowadays. Okay, and remember for Saudi also they're starting the localization or Arabinization. So as a part of that, they are changing the criteria for exams and all. So recently, if we are, during documentations and all, they are telling some new criteria, and also Saudi also they started the localization or Arabinization. Okay, so these are the available examinations: DOH or HARD, then MOH, DHA, Pearson VUE, that is for OMSB and HARD also, both are conducted by the time Pearson VUE. So that is like a general term, okay, or a company or management to conduct the examination. That's all. And SDLE for Saudi license examinations. Okay. So these are the exams are available. Then next, these are the types of examinations. So these are the names. Okay. Then what is the exam format? Exam format is like All are computer-based MCQ test. Okay, computer-based multiple choice questions are available. Then there is no negative marks for any examination. So we have to attend all the questions properly. Okay, so is it you think this correct or not? You can attend because there is no negative marks for any examination, any examinations. Okay, any of this kind of traumatic examinations, and the duration of examination like maximum 2.5 to 3 hours mainly. Okay, duration of examination like 2.5 to 3 hours, and we are we have to attend there. We have to reach there up to 30 minutes prior to examinations. That is why we wrote like 3 to 4 hours. Okay, so number of questions are different for different examinations. 100 to 150 question range are there. So for different examinations, different number of questions and different pass percentage are there. Okay, that's the only difference between all the examinations, and the syllabus for all exams are same. Okay, so remember that is like all are computer based MCQ questions. There is no negative mark. 100 to 150 question range are there for up to 2.5 to 3 hours. Okay, if it is 100 question, that will take 2.5 hours only, and for 150 questions, we need to they will provide 3 hours. Okay, so that is about the exam format. Then about the eligibility criteria, how can we get the register the examinations? Okay, okay, listen. Generally, it says like 2 to 3 years of experience required. Okay, and for that, why it is like 2 to 3 years mentioned like that? It is actually all the countries are considering like 2 years after completing our internship. Okay, all the countries are considering like 2 years of experience required after completing our after completing our internship. But for Abu Dhabi is not considering our internship as a experience period. Okay, so they require 3 years of experience after completing internship. That is why we mentioned like 2 to 3 years, because for different countries, different criteria for the number of experience required is different. Okay, so generally that is like the safe period is like 3 years, and we can attend for 2 years of experience for other countries also, with the 2 years of experience with the for other countries also. Okay, and recently, the last week I saw a notification that is it says like for OMSB or Oman examination, they are starting like they are requiring 4 years of experience. Okay, recently I saw the notification, and that is not yet confirmed yet, and we send a mail to them to find out is it true or false. Okay, and we didn't get any reply. We are waiting for their response. Okay, because that is changed recently. On previously, it were 2 years of experience is enough, and it stays like 4 years in somewhere in other notifications and all mentioned like that. Okay, so we are going to confirm that. We let you know. Okay, so this is about the eligibility criteria for the examinations and syllabus. Remember, syllabus for examinations all are same. Mainly, they are focusing on the mainly main subjects are clinical subjects, right? Okay, the questions are like application level questions. Okay, they want to know they want to know just like you can manage a clinic, okay, like individual, or you can manage a emergency situations. That is thing they want to know. Okay, that for that type of question or that approach will be the in all the questions. Okay, so no need for any deep theory, just all the questions will be like application level or indirect questions. How can we apply the theory in the clinic? That type of questions will be there for exam, and mainly they are focusing, that is why they are focusing the clinical subjects only. Okay, from all the clinical subjects like endo, restorative, like prosto, oral surgery, perio, from each clinical subject will be question like 10 to 15 percentage. Okay, from each clinical like questions, subject will be like question 10 to 15 percentage from each clinical subjects. Okay, and other all the basics together, that is 4 to 8 percentage only. All basics like general anatomy, dental anatomy, like oral histology, medicine, surgery, pathology, microbiology, pharmacology, all oral pathology, radiology, all this together. That is, they will ask like 4 to 8 percentage only. And in that base subject, most important is for oral pathology plus medicine or medicine, then radiology and all. Okay. So radiology, general anatomy also, because that's related with other subjects like oral surgery and so we are going to we have to give more focus on these clinical subjects like this. Okay, from each clinical subject there'll be 10 to 15, like 10 to 15 percentage of questions from each clinical subjects. Okay, and there is another part like ethics and legal issues, that is how can we manage the situations and related with the ethics, and there'll be question like that also. Ethics is also important part of the exam. Okay, so ethics, sterilization, ethics and sterilization, that is like additional topics added, additional topic or subjects added along with this clinical subjects. Okay, and these are the overview regarding the syllabus. And remember, no need for detailed theory, just like oriented. Okay, I mean, like how can we manage a clinic? That type of overview, that type of thing is required for when we prepare or study. Okay, this is about syllabus overview. Then exam fee is approximately like, I mean, when we consider that like that, below 25,000. Okay, maximum. I mean, different rates are there. Like Devachar had approximately 81,500 to 2,500, MOH typically 1,000 and 2,000 AED for DHA. And so just remember, below 25,000. Okay, for all exams generally, they generally is like below 25,000 INR. Okay, and the payment method, that is to online payment through the respective portals. For that exam registration, we have to create a for exam registrations and procedures. First, I mean, when we focus on the exam only, first we have to register to their portal, and there'll be available date shows, and we have to pick up a date. And remember, exam is conducting throughout the year. Okay, so we can attend at any time. Okay, but remember, when we take the exam date, try to take 1 month before the, like 1 month before that, 1 to 2 months. That is safe actually. When we look for the last minute, we cannot see we cannot see anything. Like the port will not be available. Okay. So for exam registrations, try to register like 1 to 2 months back or before the exam. Then we will get proper time or proper timing or for planning for the examinations or preparation will be. I mean, we'll get that. Okay, that is we're recommending like 1 to 2 months before. I mean, when we are planning the exam, 1 to 2 months before that, exam registration is preferred actually. Okay, so remember, these available exam dates are available throughout the year. Okay, and you can attend the exam from anywhere from the world. That is another advantage. Okay, so I mean, in India, many centers are there. In Kerala itself, like Trivandrum, Kochi are available as exam centers. Okay, so remember, you can attend the exam from anywhere from the world, and the exam days are available throughout the year also. Okay. And about the pass percentage 60 to 70% generally. Some exams they will ask like 70%, like for example, Dubai DHA. DHA is 70% required, and for other prometric examination, 60% is enough to clear, and for Oman prometric, that is 65%. So, like a range of 60 to 70% required to clear the examinations. For different examinations, different pass percentage required. Okay, I mean, actually, it is very hard to say about the pass percentage and all for the skill funded examinations, because they will not show any mark. Okay, they'll just show like actually exam result, they show like fail or pass only. For Qatar exam, sometimes they'll show the percentage of the mark for each subject and but generally they for other examinations and all they'll like give the result like fail or pass only. So that is why we I mean, it's very hard to say about exact percentage how much required to exam. Okay, because they are not relieving anything. That is the main thing. Okay, they are not relieving any question or their questions or pass percentage or any detail regarding examinations in anywhere in their site source. Okay, they will give an overview regarding the registration standard, but not related with the syllabus. Syllabus is I mean, like few topics are there. That's all. Okay, syllabus, or they are not exposed their questions. Okay, they are not telling about the past percentage. Okay, but we are collecting many data from the previous candidates and all. Previous candidates will get the exact we'll get that type of information. So okay, how much amount, I mean, how much percentage is required to clear the exam. Okay, so remember, this is like from previous experience, from collecting all the data from previous candidates and all, we are training like, and in sometime they will give the notifications also. And from all the collecting points, we are telling that 2 to 3 years of I mean, the result will come within 2 to 3 days. And for some exams, suddenly in front of your screen. Okay, that's also there. For example, OMSP, like Oman Prometric examination, on the same day you can see the result. Okay, after completing the examination, you can see the result. Okay, and passing score is 70%, like you like mentioned. Okay, remember, So this is about the way to the exam. Okay, how can we get into the examination? This is a thing. Remember, and here along with examination. Mean Okay, someone is asking about QCSP, and I will clear it after the meeting. Okay, other comment. So remember, okay. So exam is only one part of this licensing. Okay, licensing along for the licensing, different procedures are there. Okay, the thing is actually they have to evaluate our certificates are valid or they are genuine and all. Okay, so they will cross check with our university, our like dental. I mean registration form and all. Okay, I mean in the dental registrations and all. So they have to cross check everything, and for that we have to give a fees to the university and for the mandate. Okay, so that is why we require more amount during this. Like not only for this registration, the amount is like below 25,000, and for the other thing is document evaluation, that is known as data flow or credentials are there. Okay, some countries data flow, credentials, and examination. These are three procedures, and some countries just data flow and credential. Data flow and the exam registration only. Okay, so depending on different countries, different procedures are there, and okay, when we get to the deep, there are many complications, many things are there. Okay, actually, so for that, all the clearance and all, you can contact our documentation team for every details regarding this. Okay, how can we get into that, and what are the the certifications? The certificates required and all. Okay, generally they are asking for the dental registration. Okay, dental registration, then degree certificates and degree certificates and passport is the main thing. Okay, when we go on to exam also, when we are attending the exam at that time also, passport is very important. Okay, they'll ask about in the exam hall, they'll ask about the passport and the hall ticket. Okay, these are two main things required during when we attend the exam. Okay, so remember, for this licensing procedures, you need to register for the examinations, and whether you are you want to do data flow or credentials. Okay, and after completing all this, there'll be will complete license will get for us. Okay, so this is actually licensing procedures. Okay, this is about the complete licensing. How when we can work in a Gulf countries, that is after completing all the procedures. Okay, this is about this procedures. So remember, for details regarding all the procedures, that will you can contact us for the exact details or the for each respective countries. Okay, then we can clear that. Okay, and remember, this is all about general examination, general dentistry examinations. Okay, remember, for specialist examination, that is little bit different. Okay, because for specialist examination is actually it is very easy to attend the exam. Okay, easy to clear the exam, because for special examination they'll ask the questions from that specific subject only. For specialist exam, they'll ask the question from that specific subject only. But remember, for general examinations we have to read all the subjects. Okay, throughout. What we studied in the colleges. Okay, that all the subjects required for general dentistry examinations, but for specialist, that special category only. Okay, so that is why it is very easy to clear the specialist examinations. For specialist examination also, they require to minimum of 2 years experience from after completing our PG. Okay, post graduations, and that is about specialist examination. For that also we are doing procedures. Okay, the procedures also to be different. We have to add all the experience certificates, and remember, minimum 2 years of experience required after this completion of post graduation is recommend required for specialist examination. Okay, so remember, and this is an overview regarding the how can we attend and how can we work as a dentist in the in the Gulf countries. Okay, remember. Sorry. So remember, this is about the overview regarding the skill funders or traumatic examinations. Okay, so these are the names and what will be the question patterns like that. And the thing is, during preparation, that is the main thing. Okay, that we are providing. Okay, we are focusing for the how we can help you to clear the examinations. Okay, or work as a dentist in Gulf countries. That is our responsibility. Okay, so regarding this preparation, that is the main thing we are focusing. And during preparation, remember one thing. There is a most interesting thing, that is there is a significant difference between what we taught in the universities and what we are doing in the clinic, and what they will they will expecting that from our girlfriend is examinations. All things are different. Okay, so sometimes we have to completely forget our what we taught in the universities and all. Okay, because some some aspects. Okay, some aspects are very different for this girlfriend is examinations when we compare both clinical experience and the university studies. Okay, college studies. So for that, a perfect guidance is required for this preparation. Okay, that's the thing. Okay, we cannot do it by completing our theory book and all. Okay, we cannot clear by all that. Okay, so no, theory actually not like for theory just no overview is enough. Okay, for theory just no overview is enough for these examinations. And after theory, the most thing is actually we have to do many number of questions. That is the most important thing. Okay, so we have to do many questions, and that should be recent questions also. Okay, so for that we are providing the courses like long term courses, short term courses, and very crash courses also. I mean, like 4 days of crash courses also available. Okay, long term courses like there is 4 month of course, and that will be on Saturdays and Sundays, and with the timing of 6:30 to 9:30 p.m. Okay, evening 6 to 9:30 p.m. on Saturdays and Sundays, and that is a 4 month, and that is long term course. Short term course that is like 35 working days, and the timing is 7:30 to 9:30 7 to 9:30 p.m. Okay, that is also in the evening, and that is from Monday to Friday. Okay, and crash courses are there. 4 days crash course, that is question paper discussion only. Crash course include question paper discussion only. Okay, and question paper discussion only, that is for 4 days, and the timing is same like 6:30 to 9:30. That is a 4 days class. Okay, so these are the courses available from our side. And remember what we are doing in this batch. Okay, what we are covering, that is, first, we'll cover all the subject, all the theory in detail, because the basic theory is required. Okay. Then, if you know the basic theory, you can attend any type of exam, any type of question. That is the thing. Okay. So, we'll cover each subject theory in detail, and after completing each subject, we'll conduct a exam paper discussions. Okay, from that specific subject only, and all the questions will be like previously asked questions. Okay, and after completing all the subject way paper discussions, and in between that there'll be exams also. When we complete 2 or 3 subjects together, we conduct an exam also. Total 4 exams are there in our batch. Okay, and after completing this, for examinations, then theory in details, and mainly we are focusing clinical subjects. Okay, for theory also, and then clinical based subjects for that subject based paper discussions. After that, after completing all these things, last we'll cover 10 general papers. General papers mean the paper contains questions from all subjects together. Okay, the general paper, that is paper contains questions from all subjects together, and that is finally. Okay, and 10 general papers are there, and this is our capsule or scheduled batch. Okay, and after completing this, you will get a proper idea about the type of questions. Okay, because we collected this question, I mentioned that it is not possible to get the question directly from the ministry. Okay, they are not exposing, they are not relieving, not providing anything from their side. Okay, and we are collecting the questions from all questions from the previous candidates. Okay, so when someone attend the exam, we'll call them and collect exact question standard. So we are collecting that. So almost 3,000 plus previous questions are there with us, and the all 3,000 plus questions we discuss in our batch. Okay. So in this time period, after when we complete this 10 general papers, up to that, we'll cover almost 3,000 plus questions in our batch. Okay. And along with that, will if we are updated questions will be there. Like if we are getting a few many new like entirely new questions recently, then we'll that also included in that in our batch. Okay, so that is our batch. And after completing the batch, remember, we'll provide the 9,000 plus question series, okay, to you. I mean, question booklets to for additional reading. That is also very important. Okay, for additional reading, we have to complete like many extra questions. Okay, because this is not enough. I mentioned that there is nowadays there is no they will not ask exactly previous questions. Okay, exact previous questions or the same question, the same options that was there in previous time. Okay, but nowadays, early time, it was very easy to clear the examinations because there'll be exact previous questions along with the that is exact or same options was there. Okay, then will be easy to clear the examinations after studying all these questions. No need to cover theory or no need to read anything extra. Okay, but nowadays
they are just a little complicated. They're making this little complicated because of that. You know that all things are saturating, and there'll be there is many like competition is increasing, right? Okay, so for that they are changing the exam type also. I mean the question type also. Okay, so remember nowadays they'll ask the question like they are not repeated, but repeat question will be there, but different manner. Okay, like there will be repeat question, and that repeat questions asked in different way. Okay, with the different options. Okay, so for that to get that type of questions or to crack any type of this in that questions, you have to know the basic theory. Okay, you have to know a basic theory to exactly get this. Okay, so after getting a proper basic theory, then when we see a questions you can like compromise like I mean when we see a lengthy very long or lengthy application level in that questions, first we have to shorten that. Okay, first we have to shorten that lengthy question, and then we'll get answers easily. That is the thing. Okay, so for that you have to know exact, you should know the exact idea what is going on there. Okay, what is the theory behind that, and how can I mean what are the different types of questions related with that and all. Okay, so when you read the questions you have to remember all these things. Okay, what the theory behind this like that, and this type of questions I already solved previously. Okay, that type of thoughts you have to come like that. So we are that is why we are recommending like we need to read many like extra questions. Okay, so along with this our batch and 3000 plus questions, we will provide the 9000 plus questions also, and you have to complete as your time and all. Okay, that is why we are recommending like when you take an exam date, it is recommended to take minimum like provide a minimum gap of 1 month after completing our batch. Okay, minimum gap of 1 month is required for proper preparation after completing our batch to attend the examinations. Okay, so when you attend the batches, okay, at that time you have to remember this point and do the take the exam date. Okay, that is important thing because we have to cover all these things. And after completing all these things as we are providing, okay, and as we are guiding, then you can definitely clear your examinations. Okay, you can definitely crack your examinations. First thing. Okay, so remember the preparation is very important, and you cannot prepare it by using your booklet, your notebook or your theory book. Okay, actually theory, I mean we'll give the theory in a capsule form, so no need to read anything extra for theory. Okay, so we are giving like written notes or capsule form of each subjects in that area, so clinically relevant topics only. Okay, so no need to read in very vast way, just focus on the booklet. Booklet means we are providing the notes during discussion. Okay, so just to stick on the notes for theory, that is enough. Okay, no need to read anything extra from outside. Okay, if you want to read anything extra, you can collect question from anywhere and you can do that. Okay, so questions are more important after completing this capsule form of the theory. Okay, so theory is important, that is why we are providing theory, but in the capsule form no need to go for the theory books and all. Okay, detailed theory large books and all, that is not needed. Just to focus on our notes. Okay, notes they are providing during our discussion or batches. Okay, and for theory that's not is enough. Our note is enough, and after that during preparation also just read our notes, then do our question discussions. Okay, and at that time you can complete this 3000 plus questions. Okay, and after completing this you have to go for that additional reading questions. Okay, and after completing that perfectly with the clear complete properly. Okay, perfect means properly when you cover all the subjects and theory questions and all, you can definitely clear your examinations. Okay, so if you have any doubt regarding this batches or regarding this documentation, and you can contact us. Okay, for documentation there is a 10 years of experienced person is there with us team with the team with the head of the almost 10 years experience too. And you can she can, the name is Sinu, and she can clear all the detail, all the doubts regarding documentation. Okay, because when we get into the documentation there'll be many complications. Okay, because depending on the number of, some dates will be when you look for the number of years of experience, narrow difference between the registrations and passing time, when like graduation registration, graduation,
and if there is any difference, that will be complicated. Okay, so that type of queries, if there is any queries regarding that type of queries, you can contact us. Okay, and for examinations, we are providing this much of, okay, and we have many, I mean, research like 90 to 100%. That is depending. We are saying like 90 to 100 because that is depending on your effort also. Okay, not only from us, and your effort also required. That is why, like after completing, okay, welcome to our batch. And after completing our batch, you I mean minimum take a minimum 1 month for hard working. Okay, give your maximum with that things, and within the 1 month you can completely clear, completely cover all these things up, like all the syllabus and the covered portions and all, and after you can attend the exam with the maximum confidence. Okay, because you will definitely clear your examinations. Okay, so remember, for any doubts, contact us. Okay, Eden from Eden Routine. Okay, thank you.